Dr. Liu, what happens when a patient comes in with a denture and the denture doesn't fit anymore, and maybe the patient thinks that there was a bad denture, it should last longer, because it becomes all wiggle-woggly and very uncomfortable to eat and falling out. But then in many cases I hear that it's nothing to do with the denture, it's just simply that the person's gums were shrinking and almost like a child growing. Nothing wrong with the shoes, he just grew out of them. and that seems to be happening. Now, what are the options there these days to, so to say, fix and or replace that denture?
You're totally right, Helmut, and you're right in that the gums and the bone change and recede, and the best and the ideal way to fix that is what we call implant retained dentures, and we use implants depending on where and how many to basically hold the dentures, and usually those when done can last you same thing for the life of the patient.
Well, how does that work? Do you use the same denture which the patient brings in and put, how do you do that whole thing? So you put a few implants in it and you screw the denture to the implants, and again, are you using the same one, or do you need to use it to make a new denture? Tell me.
Well, it depends, Helmut. It depends on how old their denture is. It depends on how well their old denture fits on them. In most cases, we may need to make a new denture for them. And basically how the process works is we would put anywhere from 4 to 6 implants in their mouth. And if it's their old denture, we would need to realign it to where the implants are placed so it fits and it holds. Or we would send it to the lab and they would make a new one to hold the new denture.
Interesting. Now that denture, once it is in it, what advantages are there with that? Let's call it, for lack of a better term, let's call it a hybrid. You know, you have like a denture and an implant, you're kind of mixing them up. But what are some of the advantages once a person has a implant-supported denture?
Well, probably the biggest advantage is your bone won't recede anymore. Basically, what the implant does, it gives the bone a reason to stay around instead of receding, so the bone will be a little more healthy, a little more thick. And the great thing is the implants are going to hold the dentures and not your gums and the bone, which will change. So basically it gives it more support and it won't move around, it won't change, and it's very, very rigid. And so you feel like almost you're chewing again with your original teeth.
Oh, wow. Well, that looks like a big advantage. And then the denture will not, you said the bones will not shrink anymore, and then so the implants support. So at that moment, that denture will hold basically forever, except some unforeseen event. If somebody wants to crack too many nuts at once or something, it will not shrink anymore like the denture before, which every few years stops working.
Well, that's correct, but it also is up to the patient to make sure they come to see the dentist on a regular basis so we can check on the implants. They still need to clean it. They still need to take care of it. It's almost like their real tooth. They still need to come in for their regular cleaning. So, but if they do take care of it, the bone around the implants, they won't recede. The bone will not, if without implants, they would recede much faster than with the implants. Like with time, anything, even with implants, they will still recede up very, very minimal.
Got it. Now, those implants, I mean those dentures, does the patient take them out and in like he would have done the other ones, or they stay in there forever and he never really takes them out anymore?
They can still take them out. They're in there very tight, so they can take them out to clean it if they get any food underneath, to clean around the implants. But it's in there pretty tight, but they still can take them out.
I see. So kind of like they're a clip-on. The implant stays in it. The titanium rod or screw, whatever, it stays in there, and the denture clips on it.
That's correct.
Well, it's nice to know that high technology and advancement has not bypassed dentistry.
No, it's actually some of the most cutting-edge technologies are in dentistry. They're always trying to find ways to, help patients, especially if you lose teeth, and implants are one of them.
Okay, well, wonderful. Again, very informative, Dr. Luz. Thank you very much.
Thank you so much.